Hi, Miss Davis. My name is Kelly. I'm your nurse today, and I'm here to administer some medications that your doctor has ordered. We're going to go ahead and start off by verifying your name and date of birth. Let's see, we're going to double check your ID band. Can you tell me your first and last name? Yes, that's Miss Ellen Davis. Can you tell me your date of birth? 9/19. Oh yes, I see you're 57 years young. That's great. Can we verify, do you have any drug allergies today? No, you don't? That's wonderful. Okay, so I'm going to start by washing my hands. Okay. Alrighty, I've gathered some supplies here. We have orders today to give you some normal saline at the rate of 125 mLs per hour. And we also have some cefazolin, 1 gram, thrown into a 50 milliliter bag. Let's go ahead and provide you some privacy. We're going to close the curtain and just make sure that you are kept private while you're getting your treatment. On my normal saline, I have an expiration date of September 2022, and that is in date. On your cefazolin in a 50 ml bag, I have an expiration date of July 2022. That's wonderful. Okay, so we're going to go ahead and just open these packages. They're sealed. Everything is clean. We're going to open this other package for your antibiotics. And everything is intact and integrity. Okay. I'm going to go ahead and wash my hands again after opening that packaging. Again, we're going to verify our dose and our volume. I have a 500 milliliter bag of normal saline that expires September 2022. In order to give 125 milliliters per hour with a 10 drop drip set, we're going to do the volume times the drop set divided by the time, which gives me 21 drops per minute. In my cefazolin in 50 milliliters, my 1 gram, given piggybacked, we're going to have a 50 milliliter bag over 10 drops per minute, given over 30 minutes per the order, which is going to be 17 drops per minute. Okay, so I'm going to go ahead and wash my hands again. Let's just re-verify your name and date of birth. Okay, we have Miss Davis Ellen. Date of birth is going to be 9/19, and you are 57 years old, correct? Okay, so I have performed my hand hygiene. I'm going to prepare the primary fluid. I'm going to open my packaging for my drip set. Alrighty. I'm going to take my paper off. I am going to roll my clamp up. I'm going to close it all the way down. I'm going to flip my bag upside down to prevent contamination. I'm going to pop the blue top off. I'm going to spike my bag. Again, we want to try to prevent touching of any of the tip. I'm going to flip it upside down, and I'm going to hang my bag. Hold on. Okay. Alrighty. Now that my bag is hung, I'm going to, I want to make sure I don't touch my site. I've removed my cap. I'm going to go ahead and squeeze the IV solution chamber and fill the chamber halfway. I'm going to go ahead and then open the roller clamp, allowing fluid to come through. I'm going to use this as my simulated where I can exchange my fluid. We're going to leave the cap on for the time being. This cap will allow us to be able to get all the air bubbles out without contaminating the patient. Alrighty. So I've gone ahead. I'm going to go ahead and clamp this back down. I'm going to close this again. Okay. I'm going to perform hand hygiene again. I'm going to put on a pair of clean gloves. Okay. I'm going to look at my IV site. I'm going to go ahead and flush it. Hold on. Let me take these gloves off again. Perform hand hygiene again. Let me move this drip set. Okay. My hand hygiene is completed. I'm donning clean gloves. Okay. My flush. Okay, I'm going to take my alcohol prep. I'm going to clean the end of my J-loop that's connected into my patient's IV. I'm going to flush it slowly. While I'm flushing it, I'm going to inspect the skin for any firmness. I'm also going to be looking for raised redness, irritation, signs of infiltration. My line flushes again well. I'm going to go ahead and scrub the needleless entry point again with alcohol prep. I'm going to connect in my set line. I'm going to remove the cap and connect it in. I'm going to remove my gloves, and I'm going to do hand hygiene all over again. Okay, so I need to open my roller clamp, and we're going to count my drip rate for... Okay, well, apparently my hanging method did not work today. So, we're going to count the drip rate for a full minute. So now we have to set the rate of our primary line. We know that the order says 125 milliliters given over a period of 60 minutes, 500 milliliters total. We're using a 10-drop set. With our order, or our volume times drip divided by minute formula, we know that we need to give 21 drips per minute. So we're going to count for a full minute to ensure that we're counting the right amount of drops. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21. Okay, so we would need to slow this down a hair and re-verify by counting again for a period of a minute. We were a little bit fast, so it was just like not even a quarter of a turn to slow the rate down to verify again that we're at 21 drops per minute. Now that we've set our drip rate at 20 drops per minute, we're going to go ahead and prepare to administer the IV, the secondary set. So we're going to prepare our hands with hand sanitation. We're going to prepare our secondary tubing. In order to prepare our secondary tubing, we're going to again follow proper procedure of making sure that everything is done. We are going to completely close off this clamp. Okay? We're going to flip the bag upside down. We're going to pop our port right here. We're going to pull the clasp off, and we're going to spike the bag again without introducing any microorganisms that we can prevent. Okay? With our cap still in place, we are going to again bleed the line, and we're going to squeeze, fill it halfway. We're going to bleed the line. We're going to make sure that we take all the air bubbles out. We don't want to run too much through. Okay, we're going to clamp it off. Okay, and then we are going to hang this line. Okay, so we're gravity feeding this into our normal saline. In order to do that, we're going to do this process. Okay, we're going to put our normal saline on the bottom on this nice nifty hook that's included. And then we're going to put our antibiotics on top. So we're going to put this here and this here. Okay. Alrighty. We're going to clamp our antibiotics completely off for just a second. We are going to perform hand hygiene again. Okay. We're making sure that our hands constantly stay clean. We're going to don our another pair of clean gloves. Okay. Oh, these gloves tear. All right. We're going to take our primed line. We're going to make sure we clamp off above from the normal saline so that none of the normal saline comes in. We're going to go to our Y port. We're going to vigorously clean it. We have already checked our IV site, but we're going to just re-verify it. Okay, so we're going to open the roller clamp all the way on our antibiotics. We have double checked the date for a third time to ensure that we're in date. All right, so we are opening this up all the way. We are going to control our drip rate by our primary line. So we're going to slowly open our primary line, and we're going to be checking the IV site at this point. We're going to go ahead and perform our hand hygiene. We're making sure the entire time that we're reassessing our IV site, we're looking for signs of infiltrate. We are going to go ahead and flip the camera at this time to show the drip rate that's being counted. Again, we have established that it's going to be 17 drops per minute. We need to administer 50 mLs with a 10 drop set over 30 minutes with the equation put into place of volume times drip over minutes. We're going to have 17 drops per minute. All right, so here's our setup. We have our antibiotics on top. We have our primary maintenance solution on the bottom. We've checked our dates. We have the piggyback line going through, connected into the Y loop. Our primary solution is clamped off. The roller ball is fully open on the secondary solution, and we are controlling our rate with the primary line. We are going to count for a period of 1 minute. 1, 2, Alrighty, so we have to slow it down just a bit. It's a little bit over, so we'll roll down just a hair more. We would re-verify at this point that our drip rate is correct. In the ideal world, we would go ahead and count all over again. For the sake of this video, we realized that our roller ball had to be adjusted a little bit, and we would recount and verify for another minute. At this point in time, we're going to clean our hands. We're going to clean up our supplies. I prefer when I clean up my supplies to go ahead and don another pair of gloves. We're going to throw everything away that we did not use. We're going to give it 30 minutes for the antibiotics to finish. Once the antibiotics finish, we're going to reassess our IV site. We're going to reopen up the primary line after disconnecting the antibiotics and continue the fluid orders for normal saline and ensure that our drip rate is correct. At this time, I'm going to go ahead and document and ensure that everything was met for patient needs.